Welcome to the Healthcare Authority's Washington Healthplanfinder webinar covering the 6.1 release. The presentation will cover the following topics: System Release Outage, Social Security Number or SSN exception updates, Compact of Free Association or COFA Islander Healthcare System updates, Lawful Presence System update, account updates, voter registration, income enhancements, responsive design, correspondence, and resources. We will also have time for question and answers at the end. The system release outage. In order to incorporate all the changes for this release, Washington Healthplanfinder will go offline Thursday, April 18th at 10 p.m. and will be back online the morning of Tuesday, April 23rd. You can check the status of any system outages at www.wahbexchange.org. This section will review the new application changes for SSN exemptions. Currently, the application doesn't ask why someone is not providing an SSN, which results in a pending Apple Health decision for many clients. With this release, most clients who do not provide an SSN will be asked why they are not providing one. They will be asked why they aren't providing it when the client is applying for coverage, attests to being a U.S. citizen or lawfully present, and is 1 year of age or older. This will reduce the number of Washington Apple Health customers with pending eligibility. On the About You screen, the hyperlink for why we ask for this is updated with more information on why we need the Social Security number when one is available. When the user clicks the Why We Ask for This link, updated language displays about the use and disclosure of Social Security numbers. All household members who have a Social Security number are required to provide it when they are seeking coverage unless they meet an exception. While the SSN is not required for household members not seeking coverage, it is strongly encouraged to provide one. If an applicant who is a citizen or lawfully present doesn't provide their SSN, they must choose the reason that best fits why they aren't providing it. The available options are: they applied for a Social Security number, they are not eligible for a Social Security number, they are living with or fleeing domestic violence, they have a religious exemption, they do not want to provide or apply for a Social Security number, or other. The individual must choose the reason they are not providing an SSN. They may be asked to provide proof of the reason they give. Here are a few scenarios you may run across. In the first example, the parent is applying for their newborn. In this scenario, they will not be asked why they are not providing an SSN for their child because the child is under 1 year of age. In the second example, the individual is not a citizen or lawfully present, so they will not be asked why they are not providing their SSN. In the final example, the parent is applying for their 2-year-old child. The SSN question will display and must be answered. This section covers Healthplanfinder updates to the Compact of Free Association, or COFA, Islander Healthcare Program. As you likely have heard, COFA Islander Healthcare is a program offered by the Healthcare Authority to pay for Islanders' premium and out-of-pocket expenses for silver-level qualified health plans. Currently, Healthcare Authority staff manually sponsors applications, but this release automates the process. When a COFA Islander is approved for sponsorship, or the sponsorship ends or is denied, language will appear in their respective correspondence explaining their eligibility. Here is an example of the coverage termination letter, which goes out when coverage ends for a qualified health plan. Here is an example of the renewal letter, which is mailed when it's time to renew coverage for a qualified health plan. Other changes include added banners to display an individual's COFA Islander healthcare eligibility, improved plan shopping experience to show available plans and zero premium due to COFA Islander healthcare eligibility, a locked tax credit slider which will automatically apply the full advanced premium tax credit, and the Pay Now button is disabled for qualified health plans for individuals enrolled in COFA Islander healthcare. Additionally, on the Your Eligibility Results screen, a banner displays when an individual is eligible for COFA Islander healthcare. This video shows the shopping experience for COFA Islanders. This page will automatically show silver level plans along with the COFA Islander healthcare logo. Plans with the logo are eligible for sponsorship by the healthcare authority. However, if the client chooses a bronze or gold plan, they will not qualify for sponsorship. Now let's explore Smart Plan Finder. Smart Plan Finder can help a client find a plan based on their individual circumstances. Once a client finds a plan, they need to click Add to Cart. To qualify for COFA Islander healthcare, the client must take the maximum credit amount. The tax credit slider will be disabled, so COFA Islanders will continue to qualify for COFA Islander healthcare. This section covers a few updates to how Health Plan Finder collects information relating to lawful presence. Users will no longer be allowed to enter all zeros for their alien or USCIS number. If a client currently has all zeros entered, they will need to update it the next time they log in. When entering a client's information into the system, users need to enter their name and date of birth as it appears on their immigration or citizenship documents. If it does not match, they will likely have to provide proof so it can be verified. Some common errors we have seen include transposing or switching around letters or numbers in a name or social security number, inputting the wrong document numbers found on immigration and citizenship documents, and switching the date and month around in a date of birth. Carefully entering and double checking these entries can reduce the amount of documents the client has to provide. The next section covers updates to accounts and the login process. As a reminder, encourage your clients to go paperless to receive their notices by email. Paperless notifications enable individuals to keep their letters in one secure location that can be accessed anytime and anywhere, receive updates on their eligibility for Washington Apple Health the same day a notice is sent, and reduce the amount of mail they receive. Letters can be mailed upon request. For all users, verification codes will be emailed instead of using security questions. The mobile app Wall Plan Finder will also be updated. The codes are valid for 10 minutes. If the user's account is locked or their password is forgotten, the user can select Forgot Password and get a verification code to update and unlock their account. Here is an example of the email that will arrive with the verification code. Individuals can use the Resend the Verification Code link if their code does not appear in their email. This video shows you how to access your account if you have forgotten your password. Enter your username and click Forgot Password. On the next page, click Next. Healthplanfinder will email you a verification code to your email on file. Enter the code found in the email and click Next. This video will show you how to unlock your account if it is locked. Click Unlock Account. Healthplanfinder will send a verification code to your email on file. Enter the code in the email, click I am not a robot, and click Next. We will now cover the updated voter registration process. The voter registration section is moving to the end of the application. Eligible primary applicants have the opportunity to transfer their demographic information to the Secretary of State to register to vote or update their current registration. They will have this transfer opportunity if the primary applicant is age 18 or older, a verified U.S. citizen, and a Washington State resident. All other users will have the option to manually register or update their registration.
When you land on the Submit Your Application page, you'll notice that the Register to Vote question exists here. You'll answer according to the customer's request. If they say yes, you'll see another question open up that asks if you'd like to register with your information already populated in the registration form. If the customer is completing the application on their own, they can select yes. In a separate window, the Secretary of State website and voter registration will open up and copy over information they've put in their application. Assisting someone over the phone, you have to say no. The Secretary of State will still open in a separate window. You'll have to scroll to the bottom and click Start Over to then set up registration to the customer by mail and have voter registration mailed to them. Please take note that this is opening in a separate window. You'll still have to go back to your window with Washington Healthplanfinder to finish signing and submitting their application.
Next up, we'll cover some changes to how we collect and calculate income. Some types of income can have a negative or loss of income. Users will be able to enter negative values for rental income, self-employment, capital gains or losses, farming income, and other taxable income. Additionally, the self-employment calculator will calculate a negative amount. Another enhancement is the income section will open if it has an error, so the client can correct the data before proceeding.
With this system release, users can input a negative income amount for rental income, self-employment income, and other, which would include capital gains, farming, and other taxable income. In the income amount field, you'll see a dollar sign with a positive or a negative to reflect that negative income. Income calculators for rental and self-employment will also calculate a negative amount if the customer has a negative amount and copy that into this income details screen. This will list with the negative before the amount, and then it would pass that negative income to Eligibility Service when they submit their application for processing. Let's take a quick look at what that income calculator would be. So let's say our customer has about $500 a month in their self-employment income, and we didn't put their appropriate deductions they can have. We'll just say they have about $600 a month in depreciation. You'll see as we go through, if a negative amount exists because of putting in those details, it'll be reflected in a red negative amount. You can then click Use Amount, and it'll copy that negative amount right into their income details screen, and you can input the rest of their information. We'll just say ARC Business. And then you can close that, and you'll then see the negative amount reflected. And this will exist on the rental income. So same thing. We'll just say $500 a month, and they have $600 in other expenses. Again, reflects a negative amount. You can select use amount, and it'll display there in a negative amount. And just to show what the amount field looks like, so if you selected other income and other taxable income, it has the option to put in a negative amount. Capital gains also has the option to put in the negative amount. And then farming income has the option to put in a negative amount. And that's what the negative deductions would look like, or the negative amount would look like displayed on the income screens.
The eligibility service will be updated to cap certain deductions to match IRS standards. In January, a system change occurred that no longer allowed a school tuition and fees deduction. This release will limit or cap the following deductions: educator expenses to $250 a year for one person or $500 a year for a household. Interest on student loans to $2,500 a year or $208.33 per month. Health savings account and pre-tax retirement contributions are also being capped at an amount based on age. This section covers the responsive design, which you may have already noticed in some of the screenshots. Healthplanfinder is being made responsive, which allows for an updated screen layout, color, and compatibility with screen reader tools. Clients, account workers, navigators, and brokers will see responsive screens and modals throughout the application.
With the update to the responsive design, let's take a look at what a customer's dashboard would look like. You'll notice that at the top they'll have a button that says dashboard, and at any time when you're throughout their application or their account, you're looking at things. If you by chance get to the home screen just looking around, you can click on the My Dashboard to return to your dashboard. On the dashboard, at the account home, you'll see similar stuff to how we had it in the past. It just looks different. It's more tiled, it's stacked, the colors are easier to see and are easy on the eyes. You'll see to the left now we have our quick links menu. You'll have a message center. This particular customer doesn't have a message center yet. We just enrolled them, but you would have a couple messages displayed, and you could go into the message center and sort the messages. You'll see their household coverage summary. You'll also see their current year coverage, and if we're cross plan years, you'd see their next plan year's coverage. Again, nothing has changed to the functionality of the system with this responsive change, but it's more user friendly. So it'll look different when you're interacting with customers' accounts. You'll see the My Household. You'll see information about customers is more tiled. It's easier to find and see. In the Document Center, if there's something urgent needed, you'll see that red exclamation point. You might have noticed on the account home the yellow warning messaging telling them we need additional information. And again, just it looks different. The tiles are a new introduction with responsive design, grouping some of the information and the individuals to their details.
The Message Center will have a large dot to show an unread message. Messages that have been read will not have the dot. Clicking View More displays all of the correspondence. By clicking View More, users can also filter by correspondence type.
When you land on the Add Your Household Members screen, you'll see that the primary applicant is listed in a tile format. When you need to add a member, you select Add Member, and you'll have a pop-up modal to input the additional household members' demographics. One thing that may look different are the buttons that were previously radio dials. Let's start entering this person's spouse. So we have Josh, ready, the social security number, the date of birth, and you'll notice this tile for the gender. You just click what you would like, the race, the Hispanic origin, and then the additional questions. How they're related, are they applying for coverage, their tax filing status, and then continuing through the tiles. When you're ready to add that member, you'll select Save, and you'll notice the tiles start to build as you add more household members. When you land on the application review screen, you'll notice that you have new functionality to close all sections or just close some sections. When you close all sections, then you can review the customer's application section by section by opening up that area with that blue arrow. You can collapse it, and then you can also open all. The application review screen will default to open all fields. This is so users assisting customers with their application can easily scroll through what has been input on the customer's application. If any detail on a customer's account has been potentially mismatched, you'll see that it's highlighted in red. You can edit right from this field by selecting the Edit button that will show at the bottom of that section, and you'll be taken to the section in the account application that allows you to edit that information. You'll also notice a blue arrow that follows you along the screen. If you click on that blue arrow, it'll take you all the way back to the top of the application. You'll also notice with the new responsive design a new look and feel to our message banners. There will be potentially informational banners with a blue eye, a yellow banner with a warning triangle exclamation box to advise that something is missing or something might be needed, and then a red message might appear to tell you that something is very important depending on the situation. Some of this design may be familiar from other system designs, but all of this is new to the Washington Healthplanfinder. When you land on the eligibility results screen, nothing much has changed except for some of the layout and the look and feel of the page. You can still click on customer tabs to understand their eligibility results. And as you scroll through the application, you may notice again that blue circled arrow that'll take you back up to the top if you select it. To move forward, you just select Next to continue to plan selection.
Clients will notice a more tiled or card view of My Cart and throughout the application. Users can see all chosen health plans on this page. This is the Confirm Your Plans page, which shows chosen qualified health and dental plans and any Washington Apple Health plans a customer may have. To the far right, you will see a Select Premium Tax Credit slider to select their tax credit amount when applicable. We'll now cover updates to the correspondence. These are the notices that are being updated for Kofa Islander Healthcare. There have been some minor changes to correspondence. For the SSN exception code, language for the important deadline to submit information and renewal forms will be updated. The renewal form will also be updated to reflect negative income. Here is an example of the changes to the important deadline to submit information letter and the renewal form to support the SSN exception. This sample renewal form shows negative income that was previously reported. Finally, we'll quickly review all of the changes coming to Healthplanfinder. Most applicants who do not provide their SSN will need to provide a reason for not providing it. Individuals can no longer enter all zeros for their alien or USCIS number. Security questions for the account are being replaced by an emailed verification code. The application screens from the client dashboard through plan shopping will be responsive and compatible for screen readers. And for COFA Islanders eligible for COFA Islander healthcare, the process for selecting a plan will be more streamlined. Next, we'll review some resources available for you. Thank you for attending our webinar. We appreciate your attendance. Here are some resources that may be helpful for you.